Hi, my name is Trinity Buckley, and I'm going to be presenting what the opioid epidemic is. In this presentation, I will discuss the many factors that have led to the opioid epidemic, as well as discussing solutions. It is important to start off by noting that all groups, age, races, sexes, statuses, and populations can be affected by the opioid epidemic. It is also important to note that with this, the person with the opioid addiction are not the only ones suffering. The friends, families, mentors, and the community also suffers at large alongside the user. There has been an increase in infants born opioid dependent since the early 2000s. Opioids are used to ease pain but inadvertently have caused more pain. The cause of the epidemic stems from the overprescribing and misuse of legal prescription painkillers and the illegal sale of opioids. Pharmaceuticals are driving the force behind the opioid epidemic. They start as prescription and lead to addiction, then different opioids such as heroin, and all leading to further possible death. Initially, pharmaceutical companies said they are safe, effective, and non-addictive. Now, more than 240 million prescriptions are written for opioid pain medication each year. The CDC says there is no change in pain reports, but there continues to be an increase in the amount of medication that is prescribed. The symptoms of opioid use range from euphoria to withdrawal. To notice opioid abuse, one should look for incorrect use of prescription medication, over-medicated individuals, an unresponsive individual, change in social settings, cravings, or needle marks in one's arm. Withdrawal symptoms include but are not limited to nausea, weight loss, agitation, sweating, dilated pupils, anxiety, and flu-like symptoms. Some of the most common pain medications that are abused are oxycodone, Vicodin, Opana, hydrocodone, and codeine. Those who are addicted to opioids quickly turn to cheaper drugs to get their fix, and this means drugs that are cut or synthetic and more dangerous. This includes pills, heroin, and fentanyl is the most cheapest and dangerous. Opioids provide a euphoric drug reward. This happens when the opioid floods the reward system of the brain with dopamine. This is done when the drug stimulates the ventral to mental area to produce dopamine. Then it releases into the nucleus accumbens, which produces the euphoric effect. The reward can also be the elimination of pain or an addictive craving. The leading cause for death for those under 50 is drug overdose. Opioid addiction is a disease that takes the lives of many. In the last 25 years, opioid misuse, overprescription, and the legal distribution of opioids have led to the death rates that were unseen prior in the United States. As you can see in this graph, males have higher rates of death than females, but both sex opioid death rates are growing rapidly. Opioids are one of the hardest addictions to break as they bring a euphoric effect that alters the brain chemistry. Abstinence does not solidify long-term recovery. Prevention, early identification, and individual and group therapy have been proven to have positive effects. Treatments must address changes to the brain, such as medications that help wean patients off opioids. These medications include buprenorphine, methadone, and naltrexone. Finding access to treatment is also a roadblock, and opioid treatment becomes a lifelong task. The user must want change in order for the treatment to be effective. Harm reduction has been put in place to lessen negative consequences of partaking in the drug use, whether it is legal or illegal. Harm reduction starts in the doctor's office with screening patients better, decreasing opioid prescriptions, and finding alternative care to opioids, such as over-the-counter painkillers or cough medications. Some harm reductions that are in the communities are syringe services, naloxone, a Narcan spray, vaccination and testing clinics, safe drug use sites, and other services. Common that users are hesitant to use these services in fear of detection of the law. It's important to note the harmful effects that opioids have on our society today and to understand that no one is immune to the effects of opioids. Thank you for listening to my presentation.